Hi, Jamie Davis here from the ANIA conference, and I'm here, of course, representing the nursing show. We have a great group of people that are just coming into the booth and sitting down and chatting with us, and we're talking to some of the speakers here at the conference. We're talking nursing informatics. So I'm excited to have Rosmary Ventura here. Rosmary, first of all, introduce yourself and tell us a little bit about why you became a nurse and what your progression to being a nurse informaticist has been.
Hi, Jamie. Thank you so much for having me. So I'm Rosmary Ventura. I'm the Director of Nursing Informatics at New York Presbyterian Hospital in New York. And the reason I became a nurse was totally by accident. So I was in undergraduate school at New York University, and someone just mentioned it to me saying, you know what, you're great with people. You love chemistry, you love biology. And I was like, you know what, you're right. And I went into nursing, and let me tell you, it's been the best decision I've ever made in my life. And the second best decision I ever made was going into nursing informatics. It is absolutely like the most premier area in my evaluation of nursing now. It's cutting edge. It's using technology to drive how we're going to deliver better patient care. And so I think that for people who may not be aware of nursing informatics, or I get approached all the time, what is it? What you say is it is using technology to improve how nurses work and how they really make a better patient experience.
That's excellent, and it's one of those things I really think that is misunderstood about nursing informatics, is that somehow nursing informaticists are not real nurses. They're not involved in bedside care. They're not patient caregivers. And yet, I think they're patient caregivers to an entire hospital full of patients.
Absolutely. If it wasn't for the nurse informaticist, just giving somebody a cell phone to say, hey, go and do better care now, it would be a complete miss on our part. So it really takes the informaticist to understand the technology. Yes, number one, you have to know what you're doing. But number two, you have to understand how it's best going to be utilized by the nurse and really understood for patient care. So it's really bridging the gap between the technology and the practice, which is our main role.
And that's why nurses are so key to being in that role of being able to interpret between healthcare and the IT side of things.
Absolutely, and we need to learn to speak to each other in a way that both groups get it. Because you talk to the IT folks and they're like, what are you talking about? So you really have to translate, well, this is what the nurse would do and this is what the patient would be seeing. So let's try to figure something out so it would work for everybody.
So what are you speaking on? I know you're co-presenting with a group of people, but what's the topic? And give us a bit of what you want people to take away from that talk you're going to be giving.
I'm so excited to present a project with my colleagues that we developed. It's really around providing real-time data to our nursing staff, our frontline staff, and to our managers to understand what's happening right now on their units. So it's very interesting because we've been automated for a very long time in our EMR. However, there's so much data in there that you can't really even find it. And so it takes you 10 minutes as a manager to understand who has a Foley on my unit. Where am I getting these counties from? How are my nurses doing in terms of their compliance with documentation? And so what we did was partner with our IT colleagues to develop a real-time dashboard around those clinical indicators that are important for our nursing leaders.
So the leaders can really see at a glance on this dashboard exactly what their unit looks like.
Exactly.
With some key indicators highlighted there. So, we need to step up our visits with this patient because we have this going on, and they've got a higher acuity level, so they need a little more attention.
Absolutely, and it was really important for us to decrease the time that it was taking our managers to find that information. It wasn't fair to them, so why did they have to hunt through 10 different charts to understand who, for example, needed a pain reassessment? Or who was missing a pain reassessment? What nurse did I need to coach to understand this is what you need to do in a more timely manner? So that's really what the goal of the project is.
So, of course, I'm going to ask another question regarding real-time data, because what about that floor nurse? What about that bedside nurse? When are we going to have the data reaching out to them so that if they don't check into their computer, how do they know what's going on with their patients? How do they know a new order's been entered? why aren't we pushing those notifications out to the nurses on their smart devices or a mobile device or something like that? I'm just curious, because I think that that's where I see sometimes that IT so far in healthcare and informatics is missing the boat, right at that one gap between the EMR and the patient's bedside, where there's not a connection to the nurse in between.
I think you have hit the nail on the head, and we certainly are working towards our mobile platform and what we want to do in terms of providing decision support to those nurses more real time, understanding that they're not sitting in front of the computer.
Right.
So why would we be sending all our alerts or developing all of those types of decision support tools within the EMR when the nurses are more mobile? We want our nurses at the bedside. But what do they need to do and have at that bedside to ensure that they're providing better care? And part of that is having a mobile device. And so we're working on that now, and definitely I see that as, where the industry's going. Excellent. In terms of nursing practice. So we are at New York Presbyterian really trying hard to develop that now.
Well, Rosmary, thanks for coming on the Nursing Show and sitting down here, and maybe you can be my go-to person in New York for some nursing informatics stuff.
Jamie, I would love that. Thank you so much for having me on.
And I want to thank all of you for checking out this section and segment here from ANIA in Philadelphia, 2015. We're talking nursing informatics. If you want to find more segments like this, you can head over to this channel that you're watching this on, or over to NursingShow.com and check out all of the segments from this event.